Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.
Hello friends, and welcome to Fairfield Today. I'm Paul Jackson, your host. Thank you for joining us, and we are again from the lobby, now the newly opened lobby of Fairfield Federal downtown. They opened it up about a week ago after being closed for so long with all the pandemic restrictions as everybody has, but now things start to loosen up, and some of the businesses like this one are now open, so that not only their drive-thru open, but their lobbies are open too. Certainly the one here downtown where we are. Thank you for joining us today. We're glad you're here. Springtime, we hope, is right around the corner. Weather is getting nicer and nicer, less snow, less rain, more sun. We like that, so springtime may be moving in. I think we're all ready for that. Our first segment today, we're going to talk a young lady that we haven't had on for a while. It's been a while. Lisa Evangelista is the CEO of the Lancaster Community Health Center, and many of you probably know what that is. There may be some that don't, so we're going to talk about that. But I was looking at some of the information on their website, and it says they are here to improve the lives of everyone in the Fairfield community, and that's a big task. I can tell you that right now. They provide access to quality patient-centered health care for all. Lisa, that's a lot going on there.
A lot going on.
If we unpack that, you guys have a big job here in the entire Fairfield County.
We do, and I think it really showed that last year during the pandemic. We were very fortunate that we didn't have to lay anybody off. We did have to close a couple satellite sites, but we all ended up at the main location to make sure we took care of our patients as well as we could. Now
we talk about Fairfield County, so your offices are your main office, administrative offices, down underneath the post office on South Broad, just below here.
It's right across the street from the post office.
And then your main clinic, I guess you'll call it your main clinic.
It's the largest clinic.
Largest one is out here on East Main Street.
Correct.
Yeah. And then you have out on Hunter Trace, and then up in Baltimore. And they operate all different hours, different needs, different settings?
They all provide basically the same service. We have a pediatrician, which we'll discuss later, at the Main Street location, but they all provide primary care. We have a behavioral health department. They all refer to our behavioral health department. So some are smaller. Our largest site has the longest hours. We're open 4 days a week. We're open really 6 days a week, 4 days till 8 o'clock at night, and then on Saturdays from 9 to 1.
Is it the Hunter Trace or was it Baltimore that has evening hours?
It's the Main Street location.
Oh, Main Street, okay.
Yeah.
And you have evening hours there to accommodate people like that. And again, they have a great website, fairfieldchc.org is the website, great website, but a lot of information on there, tons of stuff to look around and just peruse and look over. But one of the things you just talked about is that's kind of exciting. You have a new pediatrician getting ready to start next month, April?
Yes, she will start seeing patients in April. Dr. Strominger, who is currently our pediatrician, will be retiring at the end of this month.
Yep.
He's been retiring for a while, so finally he said, this is it. So we were very lucky to get Dr. Melanie Copenhaver, and she's going to be taking on his patients.
And she's going to be there more hours?
Yes, she's going to be there 4 days a week, so Monday through Thursday.
And looking at your website, a couple of the things that struck me about it, again, lots of information on there, but one of the things is that you take all kinds of insurance, and you never turn anyone away. That's something you're probably pretty proud of.
We're very proud of. We're a federally qualified health center, and because we are supported by the government, we can provide services to people that don't have health insurance, and we put them on a sliding fee. They pay what they can afford. So.
And so your money comes from grants, donations, and government funding. Is that your sources?
Yeah.
And as every interview I've done for the past 6 months, or maybe even longer since we've been back, everything has always started out with the pandemic. Everything revolves around that, no matter what business I've talked to, no matter what nonprofit I've talked to, no matter who I've talked to. The effect of that pandemic has been the overarching event in everyone's life for a year, and I'm sure that's been the case for you. So as you look back at this past year, has the funding probably especially the donations and the government funding. Has that been a little sketchy?
Actually, the government funding for community health centers has been
Good.
very good, because
Good.
they wanted us to make sure we did not stop treating our patients. We might have done it a little differently. We really got into telehealth. We really had a lot of our administrative staff work remotely. We're finally kind of emerging a little bit more because people are getting their vaccines, and so people are coming a little bit more back to work. But, we handled it, I thought, remarkably well.
Yeah.
We have a wonderful CMO we got a pandemic procedure together right away. So we could take care of the people that were sick, because there were some people that didn't have COVID.
Sure.
So they still needed to see their doctor.
Yeah.
And we have an elderly population. We have a lot of Medicaid population that needs to be seen. So a lot of it was, we would screen them, and then when we bring them in, our waiting rooms were closed for a while. They have since opened. We're appropriately spaced. Everybody's still wearing masks, but yeah, I think we're seeing a light at the end of the tunnel now. But it was pretty momentous.
You never actually closed.
We never closed.
Yeah.
We never closed. We had our couple satellite sites that we have in Baltimore and Hunter Trace. We closed for a couple months until we figured out how we were going to do this.
Sure.
And then, but we just rotated our staff, and everybody worked remotely because everybody was doing telehealth. And so it all worked out. We didn't have to lay anybody off. And I think, we're coming out of this stronger. We see we can really work together. And so, there is some good things that came out of this.
And almost everyone I've talked to who's been in your situation where you've had to do, in the medical thing, let's say, telehealth, or you've done remote things, I think what many have found, and possibly you just indicated that with you, that some of the things you were forced into doing because of this may be things that you'll carry on if this were to end tomorrow. There are things perhaps you've done in the past year that you might find are a better way, like working at home or there are things that emerged as ways to go.
And especially with our behavioral health department, the telehealth works well in that department. And some primary cares it does. If you just have a follow-up and you don't really need to be seen by a doctor. So I think a lot of this stuff will stick, and we're better at it now because we had to be. Yeah. Remote, a lot of your billing department, a lot of your administrative staff can work from home as effective as coming in. It's to get that balance, because I think a lot of times if you work totally remote, you feel out of touch. And so coming back into work, that's kind of what we're seeing. And so we're all trying to get back together. We haven't had meetings, Zoom meetings, but we have not got all together, and I think people are missing that a little bit.
It's just been, I think they said that the Arnold was just canceled like a year ago this week or something.
Yes.
Well, to me, that was the light bulb moment. It came on like, if they can cancel the Arnold, this must be
this is big.
Something is happening here, because that is the big money maker for all of Columbus and Central. And then from then it just started domino effect. Everything rolled down and everything was canceled. So televisits are the way to go. That seems to be what everybody's done. You're probably Zoomed out.
Zoom, GoToMeeting, any platform that does that, the video
where it looks
chats.
Like the Brady Bunch on the screen.
Teams. Thank goodness for Teams, because we all stay connected through that, through work. But you adapt. You adapt how you have to adapt. And I have a great team that works at Fairfield Community Health Center, so we did it.
Good. Talking with Lisa Evangelista. Lisa is the CEO of the Fairfield Community Health Center. Locations on East Main, South Broad, Hunter Trace, Baltimore, places all around. Again, a good website, fairfieldchc.org is the website. So a lot of good information there. Lots going on. We talked about the new pediatrician coming in. You have a limited amount of COVID vaccines that's ongoing that you're able to give that I see on your website. You sign up there.
You sign up at the website. What we do is we call you. We have 100 doses a week right now. Hopefully that'll go up as they get the Johnson & Johnson rolling out.
Yeah, more and more coming now. So maybe everybody's hopefully will increase.
Correct. Yeah. We don't know how soon that's going to happen, but hopefully by mid-month we'll at least maybe double. We'll get 200. But we have 100 vaccines a week, and so we sign up people, and we still are going by the age criteria because there's so many people that are
first come, first served, but it's age.
It's age criteria right now, and I believe on Thursday, I did see the governor's press conference yesterday. It's going to be 60 and above. The age is going to go down a little bit now. It's going to be 60 and older, and then some other categories, I
Right,
think policemen.
as more
Right,
comes
they're trying
out.
to, yeah, so he's anticipating more vaccine coming into the States, so
What
whether
are-
we get it or not, that's.
Well, we'll see. We'll see who gets it and who's needs it and who's supposed to
Right.
get it first. Teachers, I know, are on the front. I know for a lot of frontline people are still getting it. People that are out there more than perhaps some of us are out there. One of the things I've noticed for quite a while, you guys now are the possessors of my old grade school,
Yes.
which is only a few blocks from here, South
Yes,
School.
South School.
And I think renovation is you're going to
Very
get some
close.
study going on.
Very close.
Renovation.
Our architect is going to be submitting bids out next week, or probably at the end of this week. So it's happening. It's happening. So it's very exciting.
Will that then what would move in there? Your
It
administrative
would be
office
Main
and the
Street,
East Main
right.
would take in there. And boy, that's a lot of space there
A lot of
for
space
you.
that we can grow.
Yeah.
Absolutely. We are very excited. Very
Yeah.
excited.
So you've got some plans that you think how it's going to work out with all the people you're bringing in. Everybody will have some space now.
Oh, absolutely,
Yeah.
and room to grow.
Yeah.
But probably in 2 years or 3 years after we're in there, we're going to say, "Oh, we need more space," but that's okay.
It's a
we'll
big building.
continue
You
to
got
grow.
plenty of room to
We
grow
got room
there.
to grow,
Even if you
yeah.
needed to add on to the building. I
Right.
mean, there's in the back, as I remember, there's a large area back there. So, do they still have inside there? Do they still have the auditorium? I don't know what's in there anymore.
Yes, yeah, the auditorium, and that's actually
Gymnasium
where
floor?
that's where the administration staff's going to be,
Okay.
and they're going to.
Back when I went there, they had a stage.
Yep, that's
and then
still
they had a
there.
basketball floor, and then what must have been to me it looked large, but it was a small auditorium. Is
Yes.
that all still around?
It's all still around,
Yeah.
and where the auditorium seats are, they're bumping that out, and that's going to be the reception area. And there's a virtual tour on our website if
I'll
people
have
want
to
to
look
see what
that
it's
up.
going to look like.
Will it show what it looks like now or what it will look
What
like?
it will look like.
Okay. That's probably remarkable.
It's
the
pretty
changes.
fantastic. Yeah,
Yeah.
we were pretty excited that we were able to get that. I think we put that on probably the end of last quarter, November, December. So we knew it was coming up, and COVID has backed it up a little bit, but not as much as I thought it would.
Sure.
So
Yeah.
we just kept moving forward with it, and hopefully we can start renovations in May, end of May, 1st of June.
So I guess any information that people want, fairfieldchc.org.
Oh, absolutely. That's where
Yeah.
you find everything.
Yeah.
That's where you can
Good-
sign up for
good
the
website.
vaccines and.
Got a couple minutes here. Just touch on something. You got a fundraiser coming up at Chipotle
Yes,
on East
on Main Street. Mhm.
Yeah, coming up.
March
Is that this month?
It's March 15th, Monday,
Okay.
March 15th,
Okay.
from 4 to 8.
Coming up very soon,
Mm-hmm.
and you can find out information on the website.
Mm-hmm.
Go out there, purchase. You know how it works, and you get your receipt. You can get a nice amount going back to you
33%
guys.
comes
That's
back
a
to
nice
us.
amount.
Yes, that's
and
nice.
then also really the thing that got me on to talking to you was you have your golf outing
Yes.
is still on and probably looking much more like it's
Yes.
going to stay on.
Yes, it's that was the best thing we could have done in 2019,
Yeah.
not knowing the pandemic was coming, because golf is like one of the best things to
Sure.
social distance.
Sure.
So, our golf outing probably was our only fundraiser last year, and we are continue to have it in September, and that will also be on the website, the sign-ups whenever they start that.
And when is that? In the summer, obviously?
It's in September.
September, okay. In the fall.
Yeah, it's in the
More
fall. It'll be at the country club, and it's becoming a big draw around here. It's a lot of fun, and I'm there the whole day
Yeah.
driving my little cart.
Tough day. Better than a Zoom meeting. Lisa Evangelista, CEO of the Fairfield Community Health Center, has been with us. Again, they rely on grants, donations, government funding. Again, fairfieldchc.org, the website. Plenty of information there. Lisa, thanks for joining us.
Thank
Best of
you.
luck. We'll get you back, and maybe as we're closer to the golf outing, we'll see how things are moving with a much better summer in front
Oh,
of us.
absolutely.
Yeah.
Yes.
Thanks for joining
Thank
us.
you.
Sure. Lisa Evangelista with us from the Fairfield Community Health Center. We'll be back in just a moment.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. and we came across this town called Lancaster, and we fell in love with the downtown area where the fountain is and the memorials and the flags and all the stuff. And we looked around and I said, there's our bank right there.
There's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with the community bank where you live.
Fairfield Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here, they're conversant, customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC, Equal Housing Lender.
Welcome back to Fairfield Today. Paul Jazin here. We're again in the lobby, now the newly reopened lobby of Fairfield Federal. About a week ago they opened up, and that's good news for the community. I think an indication that things all around Lancaster and Fairfield County are opening up. You heard Lisa talk earlier, their golf outing is going on. There's more and more things happening as we move into the spring and summer here. I think we'll be able to find now, keeping our fingers crossed and the Lord willing, that things continue to get better in the pandemic situation, which means more and more openings. So we appreciate all this time Fairfield Federal allows us to come in. Of course, they're still, even this year, celebrating that Quasco Centennial, 125 years of banking. Lots of information on their website. New things coming, internet banking, lots of things to talk about. Go to fairfieldfederal.com. Been a while since we've had our guest on here. Gosh, maybe a decade. I don't know. John Slater, the Fairfield County Auditor. John, thanks for coming down.
You're welcome.
Are you able to keep busy up there on the hill in the ornate circumstances where you live up there?
You know, it's incredibly busy right
Yes.
now. And who would have guessed? But I overheard you talking to Lisa, and they're very busy. Everybody has stayed busy this last year. And we're glad for that.
And again, I mentioned this to Lisa. So we were gone. We took a couple months off when the pandemic. About a year ago right now, I mentioned that's when the Arnold got canceled and things kind of fell apart here for several months, certainly. And we were gone. But when we came back, every guest I've chatted with from then till now, almost always the first question is, how was the pandemic handled in your office? How did the county get through all that? Pretty well?
I think exceptionally well. I really do. And a lot of it was hard work. Some of it was getting lucky.
Sure.
But you talked about the Arnold, and someday you'll have to interview my brother Steve.
I think about, when I mentioned that, when you think of the Arnold, I think of Steve.
Yes, he runs that strongman competition for them and has I think since the beginning or thereabouts. And so when they canceled last year because of
crushing blow.
It was just
I don't think I realized this thing was for real until I saw that this is big.
Yeah. So one of the things that we got lucky with up there, we talk about lucky, is in 2019 we started in a project to expand our facilities from the auditor's office perspective and provide a new home for our real estate assessment folks. And that new home is at 108 North High, and that opened. We literally were finishing up the punch list in late February, early March. And so that allowed us
everything.
Yeah, it allowed us just to expand, to take people out of the old courthouse.
Perfect.
And you may remember that it was crowded in the old courthouse. We had people literally in mezzanines and stairwells.
I remember Ed Larrabee's desk was underneath the stairwell. It was across from you, but it was underneath a stairwell or something.
Exactly. I think the next employee probably would have gone in a coat closet. It hadn't really changed the footprint since the 1960s in that building, and so we really got lucky because of the social distancing necessary, the ability to not just spread out folks that are the staff that were in real estate, GIS, the map room, anything associated with real estate went across the street to 108. We were exceptionally I guess, graced a little bit. Maybe that's a good way to put it. Through the hard work of auditors across the last couple decades, they were allowed to build up a little bit of some real estate assessment funds, which come from tax collection to support real estate assessment process. And the fact that we were very frugal, hardworking. Some of those dollars over time were able to accumulate. We went to the prosecutor back in 2018, said we'd like to spend those monies, capitalize them in that building when the sheriff's office, of course, moved to the safety facility. And so got the prosecutor's blessing and used those dollars that had accumulated over the years for the remodel and the addition to that building. That building, of course, is an icon on that corner. It's been there for
I can remember it many years ago as the health department was there. If you needed a birth certificate or anything, you walked up there. And again, eventually it evolved into the sheriff's department, took it over, and they had it for many years up there. And then when they opened up their great new facility down on 33 there, that Wheeling Street, everything changed there, and that voted open. So have you guys completely moved, everything completely settled down in a year?
Everything, I think we're a year in almost,
Yeah.
and I think things have settled. Yeah, I do. It's interesting you mentioned the health department being there, because I recall that as well.
Sure.
High schooler headed to college having to have a vaccine and going in there to get the vaccine.
Sure. Long before the Clarence Miller building was all part of this.
So it's the building. Part of that is it's dedicated to public health and the public health service that went on in that building. As a public building, it's really been a public building since 1940. And so as a public building, the longest period of time was dedicated to public health.
Sure.
Actually, really 1901, that house was bought by George Berry, Dr. Berry. And it's known kind of as the Berry House around the county. And Dr. Berry lived there till basically till he passed, 1940. Dr. Berry was one of the founders of the Fairfield County Medical Society. Operated was one of the doctors in the Park Street Hospital, of which folks may know or may not know about. He also was one of those founding fathers of Fairfield Medical Center. So, talking about health here today a little bit. That building works well with that. Dr. Berry, after he passed, I went to the Red Cross, and the Red Cross started in there in World War II and was there for a period of about 10 years before the health department came in and found its home there. And of course, the health department was there right up till I think 1986, which is when the sheriff's civil and detective's office moved in there, and the sheriff's office.
Interesting too, you talk about Dr. Berry up there on that. Next door now is Hubie Amstutz.
Right.
I mean, was the Amstutz building. That's where Hubie.
Absolutely.
I mean, a lot of history just in what would be a block right there.
Absolutely.
Down to Pearl.
Yeah, and isn't that a great mural on Amstutz?
It is. That really looks nice. The county did a wonderful job there, and a lot of history there, and of course anything to salute the veterans. I'm all for that, and that's good stuff.
I know you are. One of the things I want to talk about when we get there.
Okay, that's good. The auditor, you just do many things up there. You do, in fact, I think very little auditing actually. But you do so many other things. I mean, valuations and revisions and tax appeals and sales tax. You have you're tasked with a lot from the ORC.
I think
but not much auditing.
I think the General Assembly, when they couldn't figure out who needed to handle something in the county, they gave it to the county auditor to manage. And so consequently, it's the jack of all trades, master of none kind of situation.
Catch basin for everything.
The auditor, I think, comes from the fact that we are the chief financial officer for the county. The commissioners of the budget side of things, and we manage the AP and payroll, financial reporting. And so I think that's where the audit comes from. We've got a great finance staff that manages that, along with the help of everyone else, all the finance officers around the county offices and agencies. They do.
And you handle the payroll for the county. You handle a lot of the finances for the entire county, obviously.
Roughly 900 pays. That's a pretty good.
you're over the information technology, the IT department up there. That's under your.
The IT staff is
Yeah.
reports to the county auditor. I was very thankful when we got into this COVID situation that our IT staff really stepped up and
They did a great job.
helped manage.
You didn't hear any problems.
That distributive operations that you talk about folks going home. They helped provide and facilitate for that. Did a great job.
And they have stuff
Yeah.
everywhere. I mean, the health department is out on Sheridan Drive, which of course they handle all that too. But I mean, it's just not in your building or their building. I mean, they have stuff all around, and they work hard on that.
All over the county.
Yeah, absolutely.
Yeah.
Weights and measures. I know when
Weights
you go
and
to a
measures,
gas
yeah.
station, you'll see a little sticker there with your name on it. Does Steve
Consumer Protection.
Brenstool or
Steve was a weights and
Okay.
measures inspector for a long time.
Okay.
Patrick Brighton is now.
Okay.
Patrick does a great job for us.
That's a busy
and,
job with everything
yes.
going on there, weighing and.
Absolutely.
Is it just gas stations you do, or are you in charge of other?
Scales all around the county.
Okay.
And it's interesting whether they're just point of sale scales at Walmart where they might weigh
How much
your
the ham
grapes
weighs
or
here?
whatever
Yeah,
whatever that is.
So you're in charge of that.
Yeah, so huge truck scales. We've got a number of truck scales around the county, or 100,000-pound scales, and it's intriguing to watch that. Those 100,000-pound scales, they balance. That arm swings, but they balance out to zero, and so that's really interesting. Right now, we're in the middle of dog tag collection.
I was going to mention that. That's another thing they may.
Yeah.
If you don't have a dog, you may not know that. If you do, but it used to be that's where you got them. But now there's lots of locations.
Absolutely.
Yeah.
Satellite locations
Yes.
around the county. January 31st was the deadline, but because of COVID and others.
Extended that a bit.
The commissioners extended that to June 30th. And so if you don't have your dog tag license, feel free to call the auditor's office, and we'll facilitate you getting your license.
And one thing I happened to notice when I was looking at your website, looking around there, there's a discount if your dog is spayed and neutered.
Yes.
It's a little easier on you.
Yes. I think an initiative that the county commissioners embraced a couple
That's a
of
good
years
one,
ago,
too.
and I
Yeah.
think it's a good initiative.
Yeah,
Absolutely.
with the, everything around it. And again, he's got a great website. Go on the county website. You can just search that engine and then look up the auditor's office. They've got a great website with tons of information on there about
Absolutely.
things you've got going on and assessments and evaluations you've got going on, which is almost all year long. You have something going on.
The assessing world's been interesting lately because of what's happening with our real estate market, as you may know. But we're seeing a tremendously strong real estate market in the last few years. Our last reappraisal was 2019, and those appraisal cycles are 3-year cycles, and that 16 to 19 period there, we saw values increase by 17% in the county, and that's a strong 3 years. We continue to see unemployment low in the county.
Yeah.
We continue to see sales tax grow, even
through this.
Yeah, even through COVID.
Really?
March, April, May, that period of time where a lot of people went home. 2020 over 19 was something like 3.5% increase in sales tax.
It's been almost a year since I had Steve Davis on. When we opened back up in May or something, one of the first people I had on, I was able to have Steve because he didn't have his Tuesday morning meeting. When we do the show, I was able to get him on. And, of course, that was just breaking loose then. They were talking about PPP, and everything was just going wild then. But in your assessment, the county still strong?
Yes.
Yes.
I really think so. Finances are good. There was some CARES Act monies in there. Like you said, the sales tax, which is really the largest revenue resource that the county has continued to grow. Our real estate has continued to grow because of the market. So I think the county's found itself in a good position, and I think we're doing a great job of returning services to the taxpayers as a result. And so I enjoy it.
Well, good. We're fortunate to have such a qualified individual as John Slater as our Fairfield County Auditor. Thanks for the job you do up there, and pleasure to have you on. We won't wait another decade to do this. We'll do it.
Sure.
I guarantee you we'll do it sooner than that.
Sure.
Sure.
Yeah.
Yeah.
Love to have you up at 108, kind of show that
We'd
off.
like to go up there and look at it around. We talked about it. We'll see that because that's a fabulous looking place.
It's been a challenge to have a ribbon cutting or do any of that kind of communication that
understand.
comes with
I understand.
with those kind of things.
John Slater, our Fairfield County Auditor. John, thanks for joining us. Appreciate
thank
it.
you.
And all the hard work you do up there. Thank you
Yeah,
for and
appreciate
for the
you.
county and everybody up there worked very hard through all this. Thanks a lot.
Yeah, thank
Sure. John Slater, our Fairfield County Auditor. Thank you for joining us on Fairfield Today.
Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.